If you are unfamiliar with the different types of snakes and unable to distinguish between venomous and non-venomous ones, it can be difficult to know how to respond in an event of bite. Always treat a snake bite as if it's venomous. To identify a snake bite, considering the general symptoms: 2 puncture wounds, swelling and redness around the wounds, pain at the bite side, difficulty breathing, vomiting and nausea, blurred vision, sweating, and numbness in the face and limbs. The knowledge of a snake bite first aid can be the difference between death and survival for a person that has been bitten. The outcome depends on the type of snake, the area of the body bitten, the amount of venom injected, and the health conditions of the person. Problems are often more severe in children than adults due to their smaller size. If someone is bitten by a snake, you won't know if it's a dry bite or a venomous bite. So to be safe, always treat any bite as a venomous bite. Step 1. Lay the victim down and provide reassurance. Step 2. With a broad elastic bandage, wrap tightly the bite. The compression band should be firm enough to reduce lymphatic movement but not constrict blood flow. Ensure you leave the tips of the toes/fingers out to monitor circulation. Step 3. Contact 000. What not to do. Do not try and catch and identify the snake. Do not apply a tourniquet to the limb, and do not move the person unless in immediate danger. It is vital that you don't wash the bite, and that you don't attempt to cut the venom out of the limb, and never attempt to suck the venom out of the limb. Risk factors for bites include working outside with one's hands, such as in farming, forestry, and construction. Snakes commonly involved in poisoning include cobras, vipers, and sea snakes. The majority of snake species do not have venom and kill their prey by squeezing them. Venomous snakes can be found on every continent except Antarctica. Determining the type of snake that caused a bite is often not possible. The World Health Organization says snake bites are a neglected public health issue in many tropical and subtropical countries. In the event of a snake bite, morally a person should step in and take action to help this person. Due to it being extremely difficult to tell if the bite was dry or venomous, a person should assume it's venomous to stay safe. In this case, it is vital that a person takes charge and administers first aid. Legally, according to the Royal Life Saving Society Australia, a person should be expected to use reasonable care in assessing the priorities of the situation based on their level of training. Take steps to call for further medical assistance, keep the casualty stabled until medical assistance arrive, and follow established treatment and management protocols. Bee stings can produce different reactions ranging from temporary pain and discomfort to a severe allergic reaction. Having one type of reaction doesn't mean you'll always have the same reaction every time you're stung, or that the next reaction will necessarily be more severe. A mild reaction. Most of the time, bee sting symptoms are minor and include instant sharp burning pain at the sting site, a red welt at the sting area, slight swelling around the sting area, and in most people the swelling and pain go away within a few hours. Moderate reaction. Some people who get stung by a bee have a bit stronger reaction with signs and symptoms such as extreme redness, swelling at the site of the sting that gradually enlarges over the next day or two. Moderate reactions tend to dissolve after over 5 to 10 days. Severe allergic reaction. A severe allergic reaction, anaphylaxis, to bee stings is potentially life-threatening and requires emergency treatment. A small percentage of people who are stung by a bee or other insect quickly develop anaphylaxis. Signs and symptoms of anaphylaxis include skin reactions, including hives and itching and flushed or pale skin, difficulty breathing, swelling of the throat and tongue, a weak, rapid pulse, nausea, vomiting or diarrhea, dizziness or fainting, and loss of consciousness. Obviously, treating bee stings depends on their severity. The majority of problems that require medical attention come from an allergic reaction to the sting. In most cases, complications from that reaction respond well to medications when given in time. Most bee stings for someone who is not allergic need no more than first aid given at home. Then you can avoid further stings by wearing protective clothing, using insect repellent, and staying out of infested areas. Management of injury. Treating bee stings. The best way to deal with a bee sting is to scrape it off with a sideways motion using a firm object such as the blade of a knife, a credit card, or even a fingernail. Try not to squeeze the venom sac. However, quick removal of the sting is more important than how you do it. Scraping the sting off will immediately reduce the amount of pain of venom injected. Soothing creams and antihistamines may help with the itching. If the person who has been stung is known to react badly to bee stings, a compression bandage should be applied to the arm or leg and the patient encouraged not to move. Medical help should be sought immediately. An injection of adrenaline, such as from an EpiPen, may be needed to overcome the reaction. Generally, bees aren't out to sting humans. Usually this happens when people get too close to them, especially the hive, or in an environment like a field or a place with a lot of flowers where they're looking for pollen and nectar. In emergency situations with bee stings, there exists a certain moral responsibility to act in accordance with your training and provide assistance to the injured or distressed. It would be considered a responsible action to help someone who's been stung by a bee in an accident. It would be irresponsible not to help them. Fortunately, we are not frequently tested with these situations to see just how we would respond. Is that alright? In the case of an emergency, many people are concerned with the legal implications. For most bee stings, first aid is not required and the person is able to assist themselves. In more serious cases, such as anaphylaxis and severe reactions, assistance is required. In this case, make sure to use care in assisting the priorities of the situation based on their level of training. Take steps to call for further medical assistance. Keep the casualty stabilized until medical assistance arrives. Follow established treatment and management protocols, and do not represent themselves or take unnecessary risks.
Hypothermia. The nature and prevention. Hypothermia is a condition associated with raised body temperature that can result in death if it is not treated. It can be prevented by ensuring adequate hydration, planting routes where water sources are reliable, wearing a hat and light-coloured clothing, avoiding the heat of the day, and resting in the shade. Signs and symptoms. Some signs and symptoms of hypothermia are: the individual may be flushed, have a headache, have a rapid, weak or irregular pulse, be vomiting, have blurred vision, be dizzy or unconscious. Managing the injury. If the victim is conscious, you must do the following. Firstly, give them cold water to drink. Secondly, remove any unnecessary clothing that may be storing excess heat. Thirdly, help the victim up and help them find a shady spot to rest. Fourthly, rest the victim in the shade. Finally, drape the victim with wet bandages or light cotton clothing. It is important to note that if the victim stops sweating, emergency services must be contacted immediately. If the victim is unconscious, you must begin your assessment of them with doctors ABCD. Ensure the area is safe for yourself, others, and the patient. Check for a response, ask their name, and squeeze their hand. If there is no response, send for help by calling 000 immediately. Clear the airway. Open the mouth and remove any foreign material present. Place in the recovery position. Clear the airway with the fingers. Check for breathing. Look, listen and feel. In this case, the patient was breathing. If the patient is not breathing, you must commence CPR. Continue the cooling process as described above. Drape them with wet bandages or light cotton clothing. Ensure they are then put in the recovery position and their breathing is monitored closely. Check once again that medical help is on its way. Environment. individual is most likely to get hypothermia in a hot environment, particularly when they are exposed to such heat for long periods of time or excessively, which overwhelms the body's heat regulating systems. Hypothermia. The nature and prevention. Hypothermia is a condition associated with lowered body temperature that can result in death if it is not treated. Prevention is the key, so ensure appropriate clothing and equipment, sound knowledge and leadership. Layers of clothing with a waterproof coat and pants, as well as a beanie and gloves, are needed in cold environments. Wind increases cooling significantly. A combination of wind, rain, and cold temperatures can quickly be fatal to the unprepared person. Exhaustion and lack of food can speed up this process. One of the most dangerous aspects of hypothermia is that a person may become very confused and become incapable of making decisions to treat the condition. Signs and symptoms. The signs and symptoms of hypothermia include progression of the following: sensation of chilliness, skin numbness, impairment of muscle function, shivering, stumbling, confusion, loss of speech, and poor decision-making capacity. If untreated, the skin becomes blue and cold to touch, the pulse becomes weak, and behaviour is irrational. Unconsciousness and death may result. Managing the injury. Firstly, stop at first sign of exposure. Secondly, shelter the individual from the wind and the rain. Thirdly, put extra clothing on the victim. It may be necessary to remove wet clothing. If recognized early, give them something warm to eat or to drink. If the person does not warm themselves early using the above techniques, their core temperature will continue to fall, which is very dangerous. The person needs to be warmed slowly by wrapping them in a survival blanket or sleeping bag, creating a shelter and adding warm, dry clothing. Monitor using doctor's ABCD. Do not place the person next to direct heat or re-rub the body, as this increases heat at the skin's surface and removes it from the body's core, which needs the most heat. Environment. An individual is most likely to get hypothermia when they are in an icy cold environment, such as the snow and freezing cold water. However, it is important to remember hypothermia can occur anywhere, even at home. This usually happens to elderly people in poorly heated homes. Legal and moral obligations. In emergency situations, such as hypothermia and hypothermia, there exists a certain moral responsibility to act in accordance with your training and provide assistance to an individual suffering. It would be considered a responsible action to help people that are suffering from hypothermia or hypothermia, especially as each may cause dizziness and/or confusion, which may lead to poor decision-making capacity. A person must have consent prior to providing first aid. If it is not possible to gain consent, such as if they are unconscious with hypothermia or hypothermia, then it is assumed. Furthermore, if first aid is commenced, they must use reasonable care based on their level of training, call for further medical assistance, follow the management protocols. This includes keeping the casualty stable until further medical help arrives, and they must not misrepresent themselves or take unnecessary risks.
Funnel web spider bites are extremely painful. The protein toxin delta atraxitoxin present in the acidic venom is also thought to be the prevalent compound which causes the severe effects in humans. The toxin produces a rapid effect on the nervous system. The symptoms of this effect include confusion, coma, headache, numbness of the mouth and lips, tremors, and shivering. Managing a funnel web bite. Firstly, keep the patient calm and don't panic. Try and keep him still and avoid excitement. Secondly, apply a pressure immobilization bandage and firmly apply it to the limb bitten. Be sure to constantly reassure the victim, then proceed to call the ambulance and dial 000. In order to further restrict lymphatic flow and to assist in immobilization of the limb, apply a further pressure bandage, commencing at the fingers or toes of the bitten limb and extending upward, covering as much of the limb as possible. The bandage should be applied over existing clothing. The purpose of this bandage is to further restrict lymphatic flow and assist immobilization. Symptoms of the redback spider bite. The bite of the redback spider is highly venomous. It is characterized by intense localized pain around the bite site. Other common symptoms of a redback spider bite include sweating, muscular weakness, loss of coordination, nausea, and vomiting. Legal and moral obligations. Morally speaking, to ignore someone who has been bitten by a funnel web spider is considered irresponsible. It would be considered a responsible act and morally correct to help someone who is bitten by a funnel web, as they may be not able to help themselves. If the person involved is a first aider, legal obligations do apply. The RLSSA suggests that where duty of care exists, the legal requirement is to provide a standard of care that would be considered to be reasonable. In the case of a funnel web spider bite, this would include stabilizing the patient, using a PIB if possible, and seeking immediate medical attention. Funnel web spider. The impact of physical environment. Impact of water. Funnel web spiders are attracted to water, hence are often found in swimming pools, into which they often fall while wandering. The spiders can survive immersion in water for several hours and can deliver a bite when removed from the water. The initial bite of a redback spider may only cause mild discomfort or irritation, and sometimes is not even noticed. Pain usually increases over an hour or two and may radiate up the limb. Abdominal or chest pain may develop, as may pain in other parts of the body. The pain is persistent and usually severe enough to interfere with normal activities such as work or sleep. The duration of effects vary, with only moderate pain for a few hours in some cases, to severe persistent pain for 2 to 5 days. Many people do not actually react to the venom exerted in the redback spider bite. However, those who do receive the common symptoms of the bite and may eventually need an injection of antivenom. These symptoms include nausea, vomiting, headaches, malaise, and lethargy. A redback spider bite can be life-threatening to a child or pregnant woman, but it is rarely serious for an adult. In managing the injury, ensure that you keep the casualty under constant observation. Then proceed to apply an ice pack or a cold compress to lessen the pain. It is extremely important to know that you do not use the pressure immobilization technique on redback bites. This technique is only required when dealing with funnel web bites. Remember, it is extremely important to stay calm. Do not cause any further anxiety for the patient by acting frantically. Keep cool and keep the patient in a still position. And remember, the PIM technique will only heighten the pain. Moral obligations. The moral obligations of dealing with a redback spider bite are different to the funnel web spider bite because the victim may not react to the venom and hence will not need treatment. If the victim seems to be receiving symptoms of reacting to the venom, morally it would be correct to provide ice to the patient if possible and immediately call for help. Legal obligations. If you are a first aider, you are required to assist the victim. First call for help, then ensure that the patient is not in a life-threatening situation. If they are, proceed to undergo emergency procedures of doctors A, B, C, D and stop. Stabilizing the patient is also required. Redback spider, the impact of physical environment. Redback spiders can be commonly found in logs or under rocks in the bush. as they tend to reside in dark, dry areas. In suburban regions, the redback has been known to live under roof eaves, floorboards, shelves, flower pots, or even in garden sheds.